Every day, COVID-19 statistics are splattered all over our social media timelines, in news articles, and on our TV screens. For most people, the information is overwhelming and almost nonsensical. In the 3-week period of the 1st of June 2020 to the 21st of June 2020, Eyewitness News interrogated some of the statistics released and spoke to virologist Professor Shabi Mahdi, who is also leading the first COVID-19 vaccine trial in Africa, and Gauteng Health MEC Bandile Masuku to try and understand them better and what to expect in the coming months. Here are 5 things we learned. On the 1st of June, South Africa had an infection rate of about 34,000. But 3 weeks later, there were more than 97,000 confirmed COVID-19 cases. Also, when you look at week 1, there were about 16,000 new infections in South Africa. Week 2 saw about 22,000 new infections, and week 3 had about 27,000 new infections. What does this mean? Experts say we are heading towards a peak.
So we're not yet in the peak of the outbreak. It is an indication that we're actually heading towards the peak of the outbreak. So even in the Western Cape, which is relatively advanced in terms of the outbreak compared to many of the other provinces, they're yet to peak. And it might be that they would only peak in about 3 to 4 weeks from now. So what we're seeing is really a natural evolution of the virus in terms of this particular outbreak. But we're nowhere close to the peak in the country. So things are going to get much, much more difficult over the next few weeks. And the number of cases that are occurring each day, in terms of what is being reported by the Department of Health, we need to understand that is really a very conservative estimate in terms of the true number of people that are being infected each day. It probably represents around about 1/10 of the true number of cases in South Africa. I think we need to be a bit cautious in terms of how we interpret the data, that's the information that's in the public domain.
Around the middle of this month, the pattern in Gauteng started changing, showing more daily new infections and active cases compared to the Western Cape. Does this mean Gauteng is becoming the new epicenter of the outbreak? The experts say it might not be that simple, as it's the testing that is slowing down, not the virus.
The important thing is that we really need to be cautious about making comparisons between provinces purely based on the number of reported cases. It doesn't mean that they're not reporting cases from KZN or that they're reporting only a few cases from the Free State, that there isn't much happening in terms of viral transmission. The testing part of it really informs how much emphasis we can put on these numbers. And the same thing goes, for that matter, making comparisons between countries. So as an example, Nigeria, which has got a population almost 4 times as much as South Africa, has only reported about 20,000 cases. But the testing rate in Nigeria is 1/40th. They're doing 40 times less testing than South Africa. So you just simply can't make these sort of comparisons. It might be that the Western Cape is actually worse off in 3 to 4 weeks from now than what it is currently. And that is what I actually expect. I don't think the Western Cape is on a downward trajectory at all. The fewer numbers that's been reported in the Western Cape is more a function in relation to the testing that's been done and the changes in testing strategy. There are differences in terms of the amount of testing that's being done as well as who is being tested. So the Western Cape has sort of changed its testing strategy from what existed a few weeks ago because of the huge backlog they were actually experiencing. So the sort of numbers that are actually reported can sort of distort what's actually happening on the ground. A better index in terms of trying to make that sort of comparison between provinces is not the number of cases, but rather the number of individuals that are hospitalized, which is sort of a bit more standardized in terms of the criteria that they use for hospitalization of cases, as well as for investigation for COVID-19. That information, unfortunately, is not in the public domain, and it's something that we probably should focus more on rather than focusing on these crude numbers of cases that have been reported, because there's just too many moving parts, which makes it extremely difficult to use those numbers either to quantify the true number of infected individuals in the country or to make any sort of comparison between provinces. We really need to be guarded.
It is possible that we might be becoming a new epicenter, because of the numbers, of course. And I think this is a phenomenon that we started to see and realize when we started to move into the third level of the lockdown. And we had a couple of outbreaks that have actually occurred, mainly in the mining area and also in the area around the CBD in Johannesburg, in Tshwane, and also in one of the private clinics around Ekurhuleni.
The number of COVID-19 patients hospitalized in Gauteng has quadrupled from 200 patients on the 1st of June to around 800 on the 21st of June. And in the Western Cape, the number of hospitalized patients has risen from about 1,000 on the first day of June to about 1,500 on the 21st of June. But as more healthcare workers are infected with the virus, will we have the capacity to look after the increasing number of patients in hospitals?
The Western Cape and Eastern Cape have pretty much reached their capacity in terms of the number of beds they've got available for hospitalization in the hospitals. And they're now needing to expand to this sort of makeshift type of facilities. In Gauteng, we're heading towards that as well. We're not yet there, but we're very much heading towards the point where our hospitals are going to pretty much be close on to full capacity in the period of the next 2 to 3 weeks.
Yes, we do have enough beds as of now, and we have calculated that we still have enough even in July. But you know that these calculations are calculations that don't give you an exact numbers, but we are still quite confident that we'll be able to withstand the pressure up to the end of July. And then from then, it's when we are going to start to enlist additional beds, particularly from the private sector.
Almost half of the people who have died in the country passed away in the last 3 weeks in the Western Cape alone. And the death toll is likely to increase rapidly in the next few weeks. But with the introduction of dexamethasone, could this number of deaths be reduced?
We all know that the ventilators are not really an answer to many of the problems or complications that people with COVID have. So that on its own, with the dexamethasone coming onto the space, it might also improve the outcomes more. Particularly in Gauteng, we had more better outcomes in the past 24 months.
So in terms of dexamethasone, it reduces the fatality risk by about 30%, but that is in a well-resourced, high-income country such as the United Kingdom. So there is other sort of interventions that need to be in place as well for that sort of effect to emanate. So whether dexamethasone has the same sort of effect in a South African context, where our ICU facilities, as an example, are probably not at the same level as in the United Kingdom, is difficult to tell. But certainly it will make some dent in terms of reducing the number of what we call a case fatality risk for the hospitals, for people that are hospitalized. So we do expect there to be some difference. Whether it's going to have a huge impact is really difficult to tell, because again, the other unfortunate reality is that even if we got more ventilators tomorrow, we don't have the staff to be able to man those ventilators. And putting a patient on a ventilator, in fact, is extremely dangerous if the staff that actually manage the ventilator don't know how to manage that ventilator. So ventilators and dexamethasone on its own is not going to make a difference, but together with adequately equipped staff and qualified staff, it will bring that case fatality risk slightly down.
Professor Mardi believes there will be multiple waves of the COVID-19 outbreak until 2022, painting a bleak picture of what still lies ahead for the country.
Unfortunately, it's going to be quite a dark winter, and I think the experience in South Africa is not going to be very different from what was experienced in Spain, as an example, or in Italy, where in the midst of the outbreak, the number of people that died on a daily basis were huge, resulting in mass graves, literally. And unfortunately, that is where we're heading to right now, which is really unfortunate. We could have avoided some of it unless we change path in terms of our behavior when it comes to trying to reduce the rate of transmission, of this virus. So what's happening right now, unfortunately, is that there's ongoing community transmission of the virus, and it is spreading very rapidly. And the reason why it's spreading so rapidly is, unfortunately, South Africans still are not taking COVID-19 seriously. This virus is not going to go away overnight. It's not going to go away by the end of 2020. The extent of this particular outbreak is really going to be influenced by the behavior of South Africans, and I can't overemphasize that. And then beyond that, again, we probably, even if this particular wave starts waning, it's unlikely that more than 2/3 of the population are going to be infected with a single wave, which basically tells us what's going to happen is we're going to actually experience multiple waves over the next 2 years at least. So COVID-19 is not going away when summer comes at the end of 2020. In fact, we're going to have continuous outbreaks of COVID-19 for at least until we get the vaccine, or until 2/3 of the population have been infected. And the projections are that that might actually continue right into 2022.